Welcome back all of you to Government Exams for Nursing Officer Exams. This is the Mock Test Explanation Series, Part 40. The first question, Venereal Disease Research Laboratory VDRL test is used to diagnose option 1, tuberculosis, option 2, pneumonia, option 3, syphilis, and option 4 is AIDS. Right answer here is option 3, syphilis. VDRL test detect the antibodies produced by the body in response to the syphilis bacteria. Next question. Linear burrowing of a mite at finger webs, wrist, elbows, ankles, and penis is seen in case of option 1, impetigo, option 2, psoriasis, option 3, scabies, and option 4 is herpes zoster. Right answer here is option 3, scabies. Scabies mites or sarcops scabi burrow under the skin to lay eggs, and these burrows are often seen in the finger webs, wrist, elbows, ankles, and genital areas, including the penis. Next question. In statistics, the spread of dispersion is described with the help of option 1, mode, option 2, mean, option 3, standard deviation, and option 4 is median. Right answer here is option 3, standard deviation. You can see the figure, the standard deviation highlighted here, measures of dispersion. Next question, which of the following communication techniques would be avoided by nurses? Option 1, belittling, option 2, validating, option 3, reflecting, and option 4, listening. Right answer here is option 1, belittling. Belittling is a type of communication technique in which the intentional act of making another feel worthless, empty, and dismissed. It is one of many forms of psychological and emotional abuse. Validating, reflecting, listening, etc. are good therapeutic communication techniques which should be used, and belittling is kind of bad technique or bad way of communication, a kind of emotional abuse which should be avoided. Next question, the part of mind that distinguishes right from wrong and acts as a sensor of behavior is known as option 1, libido, option 2, ID, option 3, superego, and option 4 is ego. Right answer is option 3, superego. Libido is increased sexual interest. ID, superego, and ego is the 3 layers of mind, and here superego is the part of mind that distinguishes right from wrong, or it acts as a sensor. The part of mind that distinguishes from right from wrong is superego. Next question, when examining a patient who is paralyzed below the T4 level, the medical surgical nurse expects to find option 1, impaired diaphragmatic function requiring ventilator support, option 2, placidity of the upper extremities, option 3, independent use of the upper extremities and efficient cup, option 4, hyperreflexia and spasticity of the upper extremities. Right answer is independent use of upper extremities and efficient cup. A paralysis below the T4 level primarily affects the muscles and functions from that level downwards, sparing the upper extremity. So here most of the paralysis will be lower side, not from the upper side, because the nerve supply to the arms and hands originate from the C spine, specifically C5 to T1. So here independent use of upper extremities and efficient cuff can be seen because the impact is below T4 level. Next question, a nurse is reviewing a patient's records and notes that patient has renal disorder. The nurse expects to note which of the following laboratory results. Option 1, decreased serum potassium, option 2, decreased serum phosphate, option 3, elevated serum creatinine, and option 4, increased hemoglobin level. Right answer is option 3, elevated serum creatinine level, because this is renal disorder case and the patient's renal parameter like creatinine can be elevated in this kind of renal disease cases because creatinine is the indicator of health of kidney, just like bilirubin for liver. Next question. The nurse should hold the syringe almost flat against the patient's skin at about 15-degree angle with developed while administering a option 1 intramuscular injection, option 2 intradermal, option 3 intrathecal, and option 4 subcutaneous injections. Right answer is intradermal injection. You can see the different angles of 4 different kind of injections. Intramuscular 90 degree, in subcutaneous 45 degree, intravenous 25 to 30 degree, and intradermal is the flattest one, which is 10 to 15 degrees only. You can see the figure for better memorizing this kind of methods of injections and the angles. Next question. The taxonomy of educational objectives was presented in 1956 by option 1 Max Weber, option 2 Benjamin S. Bloom, option 3 D.F. Skinner, and option 4 Socrates. So the right answer is option 2 Benjamin S. Bloom. Bloom's taxonomy by Benjamin Bloom. Next question. Rechanneling of socially unacceptable drives into more constructive activities is called option 1 projection, option 2 sublimation, option 3 hallucination, and option 4 is displacement. The right answer is option 2 sublimation. Displacement is psychological defense mechanism in which person redirects a negative emotion from its original source to less threatening recipient. Sublimation, it is a defense mechanism that directs unacceptable impulses to socially acceptable behavior. So here, unacceptable to socially acceptable, that is sublimation. S and S you can remember, socially acceptable, sublimation. Displacement, negative emotion to original source to less threatening recipient. For example, if your boss is scolding you, you cannot react to the boss because of the fear of joke. So you will go to your home and you will scold the kids. So less threatening object because kids cannot react to you. So similarly, if your superior officer is scolding you, you will scold to the inferior or your junior officers. These all are the negative emotions you are redirecting from original source to less threatening recipient. But sublimation, unacceptable impulses to socially acceptable behavior. And projection, the process of displacing one's feeling into different person, animal, or object. Example, a wife is attracted to a male co-worker but can't admit her feeling. So when her husband talks about a female co-worker, she becomes jealous and accuses him of being attracted to other women. So you are doing a mistake and the opposite party, when he is explaining some other situation, you have to project this to him so that you will defend your mistake. This is projection. Next question. Billroth 1 and Billroth 2 are surgical procedures done for option 1 gastric cancer, option 2 pancreatic cancer, option 3 breast cancer, and option 4 lung cancer. The right answer here is option 1 gastric cancer. Next question. Which blood group can be administered to a patient in emergency when his blood group is not known? Option 1 O positive, option 2 AB positive, option 3 AB negative, option 4 O negative. Right answer here is option 4 O negative. O negative blood is the safest to administer because O negative blood lacks A, B, and RHD antigens. So no antigens in O negative, making it compatible for all other blood types. Next question. To decrease bradyarrhythmia in children during endotracheal intubation, succinyl is given along with option 1 xylocaine, option 2 adrenaline, option 3 vecuronium, and option 4 atropine sulfate. Bradyarrhythmia. The right answer is atropine sulfate. The drug of choice usually in bradyarrhythmia is atropine 0.5 to 1 mg given intravenously at intervals of 3 to 5 minutes up to a dose of 0.04 mg per kg or maximum 3 mg is the permissible limit. And here Cylocaine is a local anesthetic and Cylocard is antiarrhythmic. Adrenaline is an emergency drug during cardiac arrest. Vecuronium is another paralytic agent, more long-acting paralytic agent, same like Sapsone and Colan. Next question. Which of the following statements about acid-base balance is incorrect? Listen to the negative word, incorrect. Hyperventilation causes respiratory alkalosis. Option 2. Overuse of antacid can cause metabolic acidosis. Option 3. Hyperventilation causes respiratory acidosis. And option 4. Loss of gastric juices can cause metabolic alkalosis. Right answer here is option 2. Overuse of antacid can cause metabolic acidosis. That is a wrong statement because overuse of antacid typically does not cause metabolic acidosis, but just opposite because this is antacid. It is preventing acid. So basically it will cause metabolic alkalosis. Other options you can see hyperventilation causes respiratory alkalosis because due to hyperventilation the PCO2 will be washed out which will result in respiratory alkalosis. Similarly, hyperventilation will cause accumulation of PCO2 and it will cause respiratory acidosis. Loss of gastric juice, of course, this is acid, so it will cause metabolic alkalosis, same like antacids. Next question. Ophthalmic medication should be instilled at option 1 lower conjunctival sac, option 2 cornea of the eye, option 3 upper conjunctival sac, and fourth one is the edge of the eye. The right answer here is option 1 lower conjunctival sac. The ophthalmic medicine should be instilled in lower conjunctival sac. Next question. Which of the following is not a probable sign of pregnancy? Option 1 Jacobmer sign, option 2 fetal heart rate detected by a non-electric device, option 3 Chadwick sign, and option 4 uterine contractions. The right answer here is option 2 fetal heart rate detected by a non-electric device. Here all other signs Jacobmer's, Chadwick and uterine contractions are probable sign. Here the note is a negative word, so fetal heart rate detected by a non-electric device is more specific. It is usually comes under positive sign of pregnancy. Those signs are confirmed as pregnancy. So this is positive sign. Others are probable signs. Next question. Which of the following is the drug of choice of chemoprophylaxis against rheumatic fever? Option 1 erythromycin, option 2 benzathine penicillin, option 3 procaine penicillin, and option 4 penicillin V. Rheumatic fever, the choice is option 2 benzathine penicillin. For individuals diagnosed with acute rheumatic fever, the recommended treatment to prevent recurrences and development of rheumatic heart disease is benzathine penicillin G, administered as an intramuscular injection every 4 weeks. Next question. Which of the following contains deoxygenated blood? Option 1 aorta, option 2 pulmonary artery, option 3 subclavian artery, and option 4 pulmonary vein. The right answer is option 2 pulmonary artery. The pulmonary artery is the only artery that carries deoxygenated blood. And similarly, pulmonary vein is the only vein which will carry the oxygenated bloods. Next question. All the following are vitamin deficiencies in children except option 1 rickets, option 2 simple goiter, option 3 megaloblastic anemia, and option 4 Bird's spots. Right answer here is option 2 simple goiter. All conditions like rickets, megaloblastic anemia, Bird's spots are related to vitamin deficiencies, but simple goiter, it is also known as non-toxic goiter, is a primarily caused by iodine deficiency. Okay, iodine deficiency. Next question. Which of the following tubes is used to manage upper gastrointestinal hemorrhage due to esophageal varices? Option 1 Jackson Port drain. Option 2 Saxe-Stackel Blackmore's tube. Option 3 T tube. And option 4 Penrose drain. The right answer here is option 2 Saxe-Stackel Blackmore tube. You can see the tube here. This is a kind of balloon inflated tube which will give pressure against the varices and it will prevent the GI hemorrhage due to esophageal varices. Next question. A nurse should understand that electroconvulsive therapy is primarily used in psychiatric care for the treatment of option 1 anxiety, option 2 schizophrenia, option 3 depression, and option 4 mania. The right answer here is option 3 depression. Electroconvulsive therapy is primarily used in psychiatric care to treat severe mental health conditions that haven't responded to other treatments, most notably severe depression, bipolar disorder, and tachycardia. Next question. The nurse recognizing that digitalis preparations promote diuresis should evaluate patients for a depletion of option 1 phosphate, option 2 calcium, option 3 sodium, option 4 potassium. Right answer here is option 4 potassium. If a nurse recognizes that digital preparations promote diuresis, they should evaluate patient for a depletion of potassium. Next question. Non-stress test is said to be normal if there are option 1 2 or more FHR accelerations during a 20 minutes period. Option 2 2 or more FHR accelerations in a 40-minute period. Option 3 no deceleration during a 40-minute observation, and 4 no acceleration during a 40-minute observation. Right answer here is option 1 2 or more FHR accelerations during a 20-minute period. Then only a non-stress test is said to be normal. Next question. Evisceration refers to option 1 separation of wound edges, option 2 eruption of bowel through surgical site, option 3 healing of surgical site, and option 4 darkening of wound edges. The right answer here is option 2 eruption of bowel through surgical site. We can see the two different pictures which will show dehiscence and evisceration. Dehiscence is just the removal of stitches, but the organ or the part is still inside the wound boundaries. But here in evisceration, through the opening, the bowel or the particular organs are protruding out. That is evisceration. Dehiscence is just within the boundary, but still the wound edges are separated. You can see the figure here for differentiating this and better memory. The last question of this part. Hemorrhagic disease of the newborn is caused by the deficiency of which vitamin? Option 1 vitamin D, option 2 vitamin A, option 3 vitamin K, and option 4 vitamin C. The right answer here is option 3 vitamin K. Hemorrhagic disease of newborn is caused by the deficiency of vitamin K. This deficiency leads to impaired blood clotting, resulting in bleeding, which can be a life-threatening condition in newborn. So we are winding up this session with this question. Thank you all for watching this video. Please add your valuable feedback and subscribe this channel for more exam preparations videos on this topic. Thank you so much.